We are delighted so many of you were able to join us today for this important conversation. My name is Jason Lane. I'm the Dean of the School of Education. On behalf of President Rodriguez and Provost Kim, well, she'll be welcoming also in a moment, but I would like to welcome you to this university-wide community forum today to talk about the coronavirus. I'd like to also thank many of the executive leaders here at the university for joining us today. We have Jeanette Altariba, Dean of the College of Arts and Sciences, Lynn Warner, Dean of Social Welfare, Todd Foreman, Vice President for Finance, Jim Diaz, Vice President for Research, Celo Siri, Vice President for Government Relations and Community Engagement, and Janet Thayer, our General Counsel. Thrilled to have all of you here today also for this conversation. This is something that is a critical moment for us to talk about as an academic community. We realize that while much of the attention has been paid to what is happening abroad, and rightly so, we also need to be prepared locally for what is happening, not just for our students who are returning home, but should the unlikely event or the event happen, should the virus become more local, how do we deal with our own classes? How do we deal with our students who are out doing field work and so forth? So we thought it was best to convene a conversation today with the experts here on our panel to begin to think about this so that we are prepared should something actually happen. So thank you for coming. I'd now like to turn the dais over to Provost Kim for welcoming remarks.
Thank you, Dean Lane. And good morning, everyone. I want to first thank everyone for this great turnout, and this is wonderful for this, especially with the short notice, to have such a full ballroom here for this panel. And I also wanted to thank Deans Griffin, Deans Lane, and Holtgrave for organizing this, along with Professor Fogelman from CEHC. This is an important topic. We really wanted to share with you the plans that are currently underway for our campus in the wake of COVID-19 as it becomes a worldwide epidemic. So without further ado, you want to hear from our panel, not so much from me. And this is a session to provide information to the campus, to our faculty, students, and staff, and also to take questions. So I'll send it over to the panel then. So thank you again for attending.
Thank you, Provost. I'm Bob Griffin. I'm the Dean of Disaster University here at the University at Albany. Just a couple of quick comments before I turn over to the panel. Virus and pandemic don't follow borders. They don't care about race. They don't care about socioeconomic condition. They don't care about which God you pray to. This is a situation that affects us and reminds us that we are all one people, despite what occurs. When I was at the Department of Homeland Security and people would ask me, what scenario do you think keeps you up at night? Pandemic was the one that concerned me the most. With that said, the way we deal with this collectively is through an educated workforce, an educated student body, an educated population. And what we're doing today is the first of what I think will be many efforts to get as much information to you in order for you to be prepared both here and at home. With that said, one of the things that sometimes we forget is how blessed we are on campus with national experts. And it's truly my privilege to introduce the Dean of the School of Public Health, who is a noted international expert. So if you could join me in a round of applause for Dean Holtgrave, we'll start to kick it off. And just a couple of words about today. There's going to be some short presentations, and there's going to be an opportunity for questions and answers, because we think it's really important that we engage in a dialogue with the community, not just a one-way push of information. David?
Good morning, and thank you very much, Dean Lane and Dean Griffin and Provost Kim. It's really been terrific working together with CEHC, with the School of Education, with the Provost Office in pulling this event together on short notice today. We're very privileged to have done so. Really appreciate the opportunity. And I'll moderate today. And at the beginning, we thought what we'd do is take just a few minutes, maybe 7 or 8 minutes, and address the issue of what do we think and what do we know. I used to work at CDC in the 1990s and early 2000s, and that was a phrase we used a lot because it was sometimes helpful when we were facing a challenge in public health to think about what is it that we actually know and what do we think based on our expertise and what do we not know. So before we go to our panelists and our resource experts and get into the dialogue, we thought we would stipulate a few things that we seem to know, although it changes by the minute. I wrote these opening remarks yesterday morning, yesterday night, this morning, and 20 minutes ago, and it changed that much, that fast, and I think that's the situation we find ourselves in. So a few things we know. This virus, this novel coronavirus, was relatively unknown to humans until the last 90 days or so. Its technical name now is SARS-CoV-2, and the disease that it causes is called COVID-19. And I think for ease of our discussion today, we'll either call it coronavirus. You'll know that we mean this novel coronavirus, or say COVID-19, although its technical name is really SARS-CoV-2. The disease that this virus manifests is mainly fever, cough, and difficulty breathing, and one of its demarcations is lower respiratory. So the difficulty breathing is coming from the lower respiratory system, which makes it different than some other diseases. The incubation period seems to be a few days. We're learning, but maybe about 80% of cases are relatively mild and resolve on their own. Maybe 15 to 20% or so are more serious and people need care. And the mortality rate is an area of a lot of discussion. It's probably in the area of 1 to 2%, but we'll talk more about that in a minute or so. The mode of transmission is virus particles in droplets that can be spread from human to human. And if we compare it to influenza, at this moment, since this is a novel coronavirus, there's relatively fewer cases, of course, than influenza, relatively fewer number of deaths, but COVID-19 seems to be a more severe disease, perhaps, than is caused by influenza, and the death rate appears to be higher for COVID-19 than it does for influenza, but not as high as for, say, SARS or MERS. And as of this morning, around 8 o'clock or so, globally, we had about 94,000 cases. That's increasing by the minute. Globally, we had over 3,200 deaths. We know that this is worse for persons who are older or who have underlying health challenges such as compromised immune system, heart disease, and a wide variety of other kinds of challenges to their health. And the mortality rate seems to really go up quite a bit with one's age or other underlying conditions. We're probably over 75 countries and territories right now. Especially hard hit have been China, South Korea, Italy, Iran, and Japan, but probably we're seeing other EU countries follow close behind, Germany, France, and Spain in particular. In the US, there had been, as of this morning, about 128 cases in about 16 states, 9 deaths, 8 in Seattle, 1 in Washington State nearby, most of those related to an assisted living center. And just as we saw with the Diamond Princess cruise ship, in the assisted living center where people are living together in close quarters, there seems to be more opportunity for transmission. Then going to New York State, as of this morning, it had been about 2 cases, 1 in Manhattan of someone who had mild symptoms, 1 person who was in Westchester County, but in the last half hour or so, now it's been confirmed that the case in Westchester County, 3 of their family members also have tested positive, as has the person who drove that individual to the hospital from their home. So in New York State, as of now, we're at 6 cases, no deaths. And we're starting to see things like, as of yesterday, private schools had closed, just a couple in New York City this morning, since one of the persons who just tested positive It goes to Yeshiva University. They're looking at closing one of their campuses in New York City. So this is a really rapidly evolving situation. And in New York now, we have what would be called community transmission. By community transmission, we mean a case where someone acquires the infection, but they haven't necessarily traveled to another country that is known to be disproportionately impacted, and we don't know exactly who they have been in contact with where they might have gotten the infection from. And so when you're not sure, like the first case in Westchester County, where that person acquired it, we would start to call that community transmission. Also, we have, in any infectious disease, you want to know, do you have a test, do you have a vaccine, and do you have treatment? We do have a test for novel coronavirus, but it's been very slow in getting out of CDC and having an uptake across the country. So there's been some challenges you may have read about in the media, where just now this week, there's been approval from the FDA for other parties, other academic centers, the amazing Wadsworth labs, and so on, to be able to provide testing as well. And so that's going to really ramp up testing very rapidly. Second thing we'd want is a vaccine. We don't have one. There's some early candidates that are being looked at. Tony Fauci from NIH will say we're probably a year and a half away from a vaccine that's deployable out in the community. There's testing going on much sooner than that, but a fully ready vaccine to use is a while away. And treatments, there's a number that are being studied right now, including some trials that are being very rapidly put together. That's probably shorter in terms of availability than is vaccine, because you're going to use it in a different way, of course. The treatment for someone living with the virus versus someone who needs a vaccine who's negative and you want to prevent them from getting the virus. So treatments will probably come sooner, but we're still some ways away from that too. So therefore, the only really pathway we have to deal with this at the moment is containment or mitigation to disrupt transmission using behavioral and social science public health strategies. And there's really three kinds of strategies. One is individual behavior, two is environmental cleaning, and three is social distancing. And the first, individual behavior, are things like hand washing, coughing into your sleeve, not touching your face, staying home if you're sick, calling the doctor if you feel unwell. And I emphasize calling because you don't want to just go and show up in an emergency room or in your doctor's office. It's much better to call ahead. So all of those things are straightforward, and they're useful for other challenges as well, like cold and flu, and why not do those things? So we should be doing those things as we speak. And a good example of what I mean by this is globally we're seeing more and more countries do public service announcements on proper hand washing techniques, and we're getting more and more examples of that. Secondly, a major strategy is environmental cleaning, so sanitizing surfaces, and that may be of some use, and we're grateful that Paul Masters from Wadsworth Lab, as a virologist, is here, can answer questions we have about that. But a challenge, even though these are relatively straightforward things to do, they may require further staffing and resources. And a good example of this, as we saw in the news in the last few hours, that New York City now will try and clean every subway car and turnstile and the arm rails at the stairs every 72 hours. So they sort of have this huge team of people that are sort of going in and trying to really sanitize as best they can the subway system in New York, such that all of these surfaces that are frequently touched would be cleaned every 72 hours. Then the third area, and the most complex, and I suspect what we'll be spending much of our time on today, is the issue of social distancing. So there's some things that are easy, like not shaking hands, and then more complex things like travel restrictions, teleschooling or teleworking, or other kinds of self-isolation or quarantine, or canceling big events. And I think social distancing is hard because we're social beings. We're very interrelated to each other, and everything that we do for social connection, education, economic purposes involves us working together as groups and communities. But some of these things are easier, and we can do them now. but some are more complicated, and we may have to plan for them and do a lot of intensive planning now before there's a lot of community transmission. But as we see more community transmission, be ready to implement them sort of at a moment's notice. And one of the things that you're seeing is these are put in place around the country. Even these couple of schools in New York State, around Westchester County, you're open for business until you're not open for business, and then suddenly you're in the midst of teleschooling or teleworking. So it's important to plan ahead so we're not caught unaware. And just some examples of social distancing: the National Basketball Association yesterday told all of its players, fist bump the fans, don't shake hands with the fans anymore, don't accept pens and materials from fans for autographs, to just either bring your own or just put a little moratorium on signing autographs. We've heard a lot about travel restrictions, especially to and from heavily impacted countries like China, Italy, South Korea, Iran, and Japan, including study abroad programs. And you're going to hear lots more about this from the panel as we go. Also, another example are these closing of private schools. I mentioned the ones in Westchester County yesterday. And then we're starting to see some businesses too. The Department of Homeland Security has an office in Seattle, and because one of their employees had contact with a heavily impacted area in Washington State, they closed their office yesterday. And in New Hampshire, I should say, there was a case where the person was asked to self-isolate who was living with the virus, but then went to a major event, and now they're trying to do contract tracing for everyone who went to that major event. And so you can imagine this contact tracing grows in an exponential way. If 2 people have contact with 2 people who have contact with 2 people, it grows very, very quickly about the public health measures you need to address it. Twitter has asked their employees to work from home for now, and CDC is sort of asking businesses and schools to really put in place at least a plan for teleschooling and teleworking if it becomes necessary. And so we now have, as of the last couple of days, guidance for institutions of higher education from CDC. We've also been briefed by the New York State Department of Health and the Albany County Health Department. And I would say these recommendations kind of break into 2 categories. If your area has no community transmission, the recommendation seems to be implement those straightforward behavioral change strategies, environmental cleaning, and some social distancing, especially around certain travel restrictions around these 5 countries, but plan for more social distancing. Once there becomes community transmission in your area, the recommendations are sort of to do those things, plus then implement more intensively the plans you had for the more intensive social distancing. And that all sounds straightforward, but of course the devil is in the details of how you do this. What does the travel restriction look like? What does it mean to suspend a study abroad program? There's lots of details that are important to work through. And the last thing I would say, and then I'll turn it over to the panel, is the cross-cutting themes. And I think Bob Griffin really touched on this. Throughout everything that we do, we must guard against stigma and discrimination. The virus knows no nationality, no race, no gender, no religion, exactly as Dean Griffin said. And acts of discrimination, acts of stigma are unacceptable, and we must guard against that in all that we do. Also, I think it's important to say there's a social justice issue here, and that not every person in society has the ability to take these preventive measures that I talked about. To say you should isolate yourself at your home presumes that you have a home to go to. If you're homeless or unstably housed, you might not have that shelter, and how will you self-isolate? Also, if we say that it's good to stock up for a couple of weeks of groceries, or making sure you have enough over-the-counter fever reducers in your house, or supplies for your pets for a couple of weeks if we do have to telework or teleschool, that assumes that you have the resources to do that, and not everyone in our society does. So as we think about taking these measures for ourselves, we have to look out for others in the community as well, too. And we must ensure that everyone in society has the ability to participate in these important public health measures. So finally, if we plan carefully but quickly, if we take these first few key steps now and plan for the rest, we'll be in the best position to address this outbreak. And lastly, I did an interview and talked about the difference between a hurricane watch and a hurricane warning. And last week it felt like we were kind of in the watch category. We were getting ready for a storm, we were planning, we were stockpiling supplies, we were making sure that we had plans. We're not quite at hurricane warning, but we're getting closer and closer all the time, and this is really unfolding very rapidly. So if we're still in watch mode, we're in quite an urgent version of watch mode and kind of getting ready in case we go to a warning phase. But I'm very happy now to turn things over to the panel. We've got a great group of people that are here today, and first maybe I'll introduce our resource experts first, and then I'll go to the panel as well. So that we didn't have a panel of a dozen people, we thought that there were many aspects of this that you might have questions or thoughts or comments about. So some of the people who are here to answer questions, and let me give their name and title, and if they could just raise their hand. Gus Burkhead from the School of Public Health, who's done a lot of infectious disease work at the Health Department and now on the Faculty of Public Health. Billy Francini from ITLAL is here, the director. Billy, thank you for coming. Paul Masters from Wadsworth Labs is here, virology, a very senior scientist in virology. Clarence Clay McNeil, Dean of Students. Great, thank you very much, Clay, for coming. Chris Moore from Educational Testing Services. Great, thank you, Chris. Samantha Penta, a faculty member in CEHC, and Eric Stern, also another faculty member from CEHC. Thank you very much for being here. And on our panel here today, first I'll name the person who will come in late, and that's the Albany County Health Commissioner, Dr. Elizabeth or Liza Whalen. The county executive had a news conference talking about what Albany County is doing, and that was from 10 to 11, and she told us she would come over here right away after that, so we knew that she would be quite late to the session, but we're always happy to have Dr. Whalen involved in our discussions. Also on the panel are Kevin Wilcox, our Associate VP for Enterprise Risk Management, Gilbert Valverde, the Director of International Education, and Kristen Swaney, who's from the COVID-19 Academic Accommodations Work Group. And what I'd like to do is first turn to the panel, give them each a minute or two to say a word about what area of COVID-19 they're working on, and then after that we're just going to open it up for questions. We would love to hear from you, your thoughts, questions, and comments. And Kevin, is it okay if I turn to you first, please?
Good morning. My name is Kevin Wilcox. I am the Associate Vice President for Enterprise Risk Management and Compliance. Well, just so you know, includes a lot of the areas that are working on this, including emergency management and risk management, compliance, and a variety of other areas. I've been working, just so you know, because I want to knock down a few things right out of the gate that'll probably be questions that everybody has. We have been working on this since late January. This is not new to us. We stood up an overall task group on this to start under the Provost's direction in late January. Since that time, we have been tracking all students, all faculty and staff we're aware of, all visiting scholars, and any other visitors to our campus that are coming from affected areas. Obviously, it started with China and has now expanded to other areas. Just so you know, anyone who came in from those areas, especially students, they have been self-isolating for 14 days before they're allowed to come onto campus. They've been in contact with our health services before they could come onto campus, so they have been cleared. I know everybody's hearing about returning students from study abroad. I don't want to get too deep into that. Because Hilbert can talk about that. However, just to lay fears there, any student that is coming back from an affected area, study abroad, will not be coming back to campus directly. They will be going to be self-isolated in one of two ways, either at home or at a centralized facilities that the governor is arranging. So I just want to allay those fears. We are taking that into account. They will be cleared medically before they would even come back to campus. There are possibilities they would not come back to campus at all this semester because frankly, they're right in the middle of their semester abroad. And for academic reasons, they may take online courses we're developing or something else, or they may be home. So I don't want to lay that fear right out of the gate. The other thing, real quickly, we have stood up a number of work groups that are right now working daily on a lot of different areas. One is to prepare the campus for a pandemic, or if for some reason, and let's all hope we don't get there, we had to close the campus. How do we handle it from a facilities, from food service, from residential life? That is all being reviewed. There's also an academic accommodations group. There's actually two. The one that's working is for those students who are coming back from study abroad, how do we accommodate the fact that we've truncated their semester? And some of them in South Korea hadn't even started the semester yet because they delayed opening of the universities there. How do we accommodate them? We do not want students to be impacted economically or from an academic perspective and lose a semester. That's all being worked out, whether it's moving classes all online, whether it's new courses we put together, where it's using second part of the semester, 8-week courses, that's all being worked on. Another academic group is working on, a lot of the same people are working on, if we did have to close for some reason the university. And now we're a ways from that, but this is very, very rapidly moving. How would we accommodate all of you that are here right now today for the rest of the semester? So that's all things that are being worked on. And there's also a group that is looking at our impacted students that are here on campus with us today, who maybe have a loved one who is ill, or unfortunately a friend or loved one who's passed away in an affected area. We need to show these folks some support, and we need to work on that as a campus community, that we have these people's back, we understand what they're going through, and there's a lot of work going into that area to support those folks. One last thing before we move on is spring break is going to come up. It's coming up very soon. We sent out a message to all students strongly discouraging travel, and this is for faculty and staff as well, strongly discouraging travel to an affected area. If you travel to an affected area, which at this point, and this will change, and that's one of the problems between now and when you come back, there's going to be more affected areas. And there's a risk that you may not be able to get back into the country at that point, or be put in isolation by the federal government. They're not there yet, but we just don't know where this is moving. But if you travel to an affected area, you must self-isolate under New York State Department of Health direction for 14 days upon your return. So please be aware of that. And the way we're going to keep this community safe is people cooperate. People respect the rest of the campus community. And even if you come back from an area or travel and you feel fine in an affected area, that doesn't mean you're not a carrier. And you can't say, I feel fine, I'm going to just arrive on campus. Now you've affected potentially a lot of your community members. So I just can't stress that enough about travel for spring break. Please adhere to the advice that we're putting out on that. I know it's inconvenient, but this is a very, very serious situation. And I'll turn it over at this point to Dr. Valverde.
Good morning. My name is Gilbert Valverde. I am Interim Vice Provost for Global Strategy and Dean of International Education. We have been working on the coronavirus issue since my appointment to the Center for International Education and Global Strategy. I would like to remind all of you researchers that correlation is not necessarily causation. We begun, of course, with the outbreak of the virus in China and helping deal with the study abroad challenges that this presents. Since the beginning of the outbreak, we've been in contact with all students in study abroad programs, beginning first with general information about hygiene and prophylaxis. But as the virus extended and as there began to be hotspots of viral infection, we began to work with aiding students in making decisions about returning to their homes for self-isolation. Some of you will note that this morning the Prime Minister of Italy, Giuseppe Conte, has closed all schools and universities. This, of course, has implications for our study abroad programs in Italy. We do not have a similar situation yet in South Korea and Japan, but we are prepared for it. And students are being informed continuously about what we know. It is also important for us to communicate with their parents. Many families have called us. There are a great number of misconceptions about the virus and about decisions being made by the university. The Center for International Education and Global Strategy is committed to the extremely important academic value of study abroad. It is only under the most extreme circumstances when we believe a student's health, safety is in jeopardy, or they will have difficulty in returning home, that we even contemplate making the strong recommendation that they return to the United States. And we feel very badly for their loss of an extremely important educational opportunity. So these decisions are not made lightly, and we make certain that we work with full knowledge of what the CDC and the County Health Department and other recommend. It's also important, from my perspective, we get many questions to the center regarding, with a certain tenure, a tenure of what are you doing at the center to keep people from returning to our community and infecting us. It's important that we not misspecify the problem. The problem is not that those others, that travelers or foreigners, are coming home to infect us. The problem is, how do we aid in mitigating the possibility of infections among us? We're one community. If we talk about affected areas, very soon people will refer to the New York as an affected area. And we're here to answer questions.
Good morning, everyone. My name is Kristen Sweeney. I am the Interim Director of the Academic Support Center. I am one of the members of the Academic Support Working Group for COVID-19. Currently, we have been working proactively with many offices across campus. With the 89 students that are currently abroad in 18 separate countries. We are currently working specifically right now working with students from Italy, South Korea, Japan, and as the virus starts to spread through Europe, Spain, and etc. We do have both a working group task force as well as a functional group for the academic accommodations team, made up of a broad variety of individuals from both academic departments, Center for International Education and Global Strategies, the Registrar's Office, ITS. We are working closely with academic departments to support our students who are currently abroad. Right now, the Academic Options Work Group is currently looking at our students who are abroad who may be affected mid-semester. Currently, we have several students who have decided to withdraw from their study abroad programs, and they are pursuing alternative options to finish their degree requirements this semester. We do anticipate that there may be more students in the near future who will be using this option. We are poised to help students in a multitude of ways. The Registrar's Office has been working with SUNY to eliminate any types of barriers for cross-registration. So we have suspended the restrictions to cross-registration for our students. We are working with departments and majors to determine if independent study or online course options are a viable option for students' degree requirements this semester. We have also streamlined the withdrawal and readmission process so that we do not create more barriers for our students who are possibly withdrawing from their study abroad programs. So we're looking at this from a whole bunch of different angles to benefit the student mid-semester. We are being as proactive as possible. We have reviewed all 89 students and their degree requirements and are ready. If a student has a question or a concern, we have notified their academic departments and are working closely so that we can accommodate these students with their academic options within a very quick turnaround. And that's what we're currently doing.
Thank you so much. And now it's my great pleasure to welcome Commissioner Liza Whalen. Dr. Whalen, as I said earlier, was this morning at a press conference with the county executive around coronavirus. And I know just how incredibly busy you are right at the moment, Dr. Whalen, so thank you for joining us today.
I'd like to thank Dean Holgrave for inviting me here today. It is a really critical point for us to get messaging out to the public, so this is a good opportunity for me to share a little bit about what we're doing at the local public health department level in Albany County to prepare. I think that, first I want to say you're in great hands. With the resources of the School of Public Health, you have so many individuals who know so much about communicable disease preparedness. We also, work very closely with Student Health Services and Dr. Grace Desimone, who has been a great partner to us over the years and is always in contact with us about concerns related to communicable disease. We did have a conference call with her and other university representatives in Albany County yesterday and have been briefed on situations like students returning from study abroad, et cetera. From a preparedness standpoint, and I know Dean Holtgrave, and I apologize I got here late, so I don't know exactly what was discussed, but I believe he's covered a situational update. I want to talk for just about 2 minutes, it'll probably be more, about how we're approaching preparedness at the local level. Really looking at how we prepare for a communicable disease outbreak or a potential large-scale communicable disease event in the county is seen through 2 different lenses. We are currently at the phase that we call containment. At this point, we have no cases of coronavirus in Albany County. However, we are very closely monitoring the situation that's occurring throughout the country, internationally, and today in New York State, we understand that the number of cases related to the Westchester case that was diagnosed last night has increased. So we are in very close conversation with the State Health Department and the CDC and speaking to them daily on guidance, pushing this information out to our partners, which include hospitals, healthcare providers, first responders, law enforcement, and of course members of the county government. Containment efforts really involve measures that control the spread of the disease as it comes into the county. And this is where we talk about issues like quarantine. So individuals that are coming back from high-risk countries, including China, we have monitored through the county health department on a daily basis for a period of 2 weeks to ensure that they are home, that they are not putting themselves in a position where if they become symptomatic, they could infect others. And for those of you without a public health background, the word quarantine is taking individuals who may have been exposed to a disease, who are currently asymptomatic, and containing them until such time period as the incubation period of the disease runs out. We have currently monitored 37 individuals. Many of them have gotten past their 2 weeks. Currently, we're monitoring 11 individuals, and all of these individuals that are in the county are currently being quarantined at home. We have only tested 1 individual so far, and this test is negative. The information we want to share with the public now is really about those preventive measures that you can currently be conducting. This, if you hear one public health message, it's wash your hands, pay attention to hand hygiene. We know that this is a droplet spread respiratory infection, which means people sneeze, other people inhale. You touch a surface that somebody's recently touched, that touched their hand, and you touch your face, and that's how you get coronavirus. So it's important for people to continue to wash their hands, practice respiratory etiquette, coughing into their elbow, and staying home when they're sick. That is the most important message that we want to get out to the public at this point. When we start to see efforts, the situation change, so we start to see, and that we don't know whether this will occur or not, but it's certainly something we're actively preparing for. If we start to see cases occurring within the county, then our focus switches from containment to mitigation. And what does community mitigation mean? It means looking at how we explore ways to alter people being in public gatherings. We may talk about selective school closures, or we may talk about general school closures. We may talk about cancellation of mass gatherings. This is not where we are, but I want to let you know it's what we're preparing for. We may not get there at all, but we have been preparing for this with pandemic influenza for years. So we are currently working with all the appropriate community partners on planning for that. From an individual level, I would request and recommend that everybody here go home and pull up the CDC website and see that they have posted over the weekend guidance for households and families to prepare for COVID-19. And this really talks about how you can consider that if you have children, they may need to stay home from school, daycares may be closed, what are your alternate plans? It's about discussing in workplaces, what are alternates for work. It's talking about social distancing. So all these measures are things that I think we're at the stage where we're asking the public to start looking at these so people can feel empowered. This is not to spread panic. This is really just to empower people to prepare for a possible eventuality. There is also guidance that has been put up for businesses that is also helpful. And of course, I'm sure you're aware there's guidance for higher education. So from our perspective, we are also at this point coordinating all the testing that's going on in the county. So this, and as with everything that I'm saying, is guidance as of right now. It could change rapidly. And I understand last night there was a significant article that went out in the national news to suggest that testing would be through individual physicians. We're not there yet. We may change this quickly, but right now all testing is going through the local health department. The New York State Department of Health has set up a COVID-19 hotline where the general public can ask questions. The Albany County Department of Health is happy to be a resource. It's important for people to know where to get trusted information, and we would recommend Albany County Department of Health website, New York State Department of Health website, CDC website. There's a lot of misinformation on the web, and it's important not to be caught up in that misinformation. And I'm happy to answer questions with the rest of the panel when possible, and happy to work with SUNY on this as the situation unfolds. Thank you.
Thank you very much, Commissioner Whalen. And so we have a good 15 minutes for comments, questions. And if you don't mind, please, I'll not only invite you, but encourage you to come forward to the mic in the center, please, and ask any questions, make any comments that you have. And maybe while people are coming forward to the mic to ask questions or make comments or suggestions, Kevin, I'll ask you a kickoff question, if that's okay. Dr. Whalen just talked about the great resources online from CDC, New York State Department of Health, Albany County Department of Health. There's a frequently asked question page at UAlbany. Do you mind saying a little bit about that?
Sure. We have on the risk management page, you can go online, look under risk management. It's there. There's a FAQs where we're keeping it up to date all the time on the latest that we've gotten to provide to you. Also, the University Health Services has a page up more about the health mechanism, how to keep yourself safe. And so those are resources you can use. We're looking to actually do more with that, and part of this is just trying to do all these things at once. But yes, we're trying to do more with that to also put out resources for students who've been affected by it here, with a loved one at home, but also how you can maybe help your community here too. So we're looking to expand that, but thank you.
Great, thanks. Yes, please.
So I've heard a lot of rumors, and you're the experts to go to. How long does the virus stay alive on its surface?
So that's a good question, and we think it's really for just a few hours. And I cannot quantify that absolutely. So that really speaks to the importance of cleaning high-touch surfaces, or if you are in a public place or utilizing a workstation that may be shared by others, the importance of hand washing.
So you're definitely, you're thinking a couple hours. I've heard 9 days. There's all kinds of stuff out there. So that puts me a little bit at ease.
Yeah, no, I don't think it's definitely not that long.
Thank you.
And I'd like to add on to that, you will see on campus that we are assigning staff for cleaning surfaces, commonly used services. Facilities is all over this. Environmental health and safety is all over this. They will be redirecting people in that manner to try to clean commonly used services more often, and you will see that around campus to do the best that we can on that.
And there is guidance in particular on cleaning surfaces, so I think that's an important control measure to put in place.
Thank you. And I should say, too, to our resources in the front, too, if there's any question or comment you'd like to add to, please just raise your hand and I'll make sure. Yes, please, Eric.
Experiences from other public health emergencies and parallel crises suggest that a lot of benchmarking takes place. People will look at what peer institutions within a university system are doing and what other universities, colleges, private schools are doing. I didn't hear much about, for instance, the SUNY system and coordination taking place there. Obviously, our sister institutions in the SUNY system are obvious points of comparison. Is there a coordination taking place, and how are we connected to what's going on in higher ed more generally? If we're perceived to be less vigilant than others, that's not a good look.
Yeah, we're monitoring. Let me start with SUNY. SUNY and the governor's office are now heavily involved in this. SUNY has set up a task force on this as well. They're feeding information down to the campus on a daily, maybe sometimes hourly basis. Especially right now, their focus is on two areas. One is on the study abroad students and bringing students home and how to do that, and the governor's heavily involved. There'll be actually chartered planes made available to go to the affected countries if students can't get themselves home. We have already asked our students to come home from those areas in any way that they can get here. SUNY is also working and involved with that, but they're also working heavily with us on the academic accommodations. There is news coming out all the time about that. And this is one thing I will say. Oftentimes if we have a campus issue, not that we're on our own, but we don't have some of the resources because there's rules in the state, in case anybody didn't notice. And sometimes we have trouble, we run into those rules. Those rules, as Kristen has said, are being removed. They're being cleared. Way is being cleared by SUNY and the governor's office on standing up courses, on potentially maybe what a credit hour is for the semester for a student. And so they're all over that, and that's nice to have that. We are working with our other campuses, but mostly also, and that was a great call the other day with the other colleges in Albany. We're watching very closely out of the Office of Enterprise Risk Management what's going on everywhere. We are monitoring Twitter for what's coming up on Twitter. We're having our Center for National Security Preparedness monitoring Twitter and our own communications folks. So if anything, Twitter or whatever account stuff is out there that's false, that we can knock that down. So we're trying to do everything we can in that area.
Yes, please.
All right, good afternoon, and thank you for this panel presentation. My question goes to Provost Kim, Clarence, or anyone, Dr. DeSimone. As we're working with our students who come to us obviously looking ill, and their fear is that they want to go to class because they don't know how the absence is going to be accommodated. Any guidance on what the campus's stance on this is for students who are coming to us with illnesses who probably should be in their rooms taking care of themselves? Thank you.
Yeah, the provost's office has already issued guidance to faculty. First of all, we're telling any students, if you feel ill, do not come to class. Okay, that's the first thing. And the guidance has been sent out to academic, the faculty about providing academic accommodations for students, not just who, because of the coronavirus, but it is flu season, okay? And we're seeing a lot of the flu, and it's been pretty tough year on flu as well. So that has been sent out, and that is something that is definitely and if we have any students who are not being provided with that academic accommodations, please go to undergraduate education, contact the provost's office, go to graduate education, let them know, because we are providing those academic accommodations so that students can feel comfortable staying home if they are ill.
Please.
Good morning. Keith Earle, physics. So the name novel coronavirus means that there probably isn't all that much information that you can share about what the course of the disease looks like. But for the public, is there an easy way to encapsulate how you would describe this? It's not the flu. It's a kind of a flu, it's not a cold, it's a kind of a cold. Could you help unpack what's going on with this?
Sure. So you point out something very important in that this is a new virus and we're still learning about it. So the epidemiologic information is rapidly evolving, but we do have some preliminary data from China. What we know about this is that it is a febrile respiratory illness, so it seems very similar to influenza. In the vast majority of people, about 80% of people, this will self-resolve. That means it'll go the course of flu. You stay at home, you are coughing, you feel miserable for a couple of days, you hydrate and take antipyretics, and then you get better. In a small percentage, in about 15 to 20% of people, that can be a more serious illness. We know that, again, this is preliminary information, but it's looking like this is striking harder in individuals who have pre-existing medical conditions, such as COPD and cardiac disease. And in a very small percentage of people, about 5%, they can have severe illness that requires hospitalization and maybe requires, I'm sorry, about 20% may require hospitalization. A smaller percentage may require measures such as mechanical ventilation, and the mortality rate is between 1% and 3%. We're still learning about this. So, you know, for people that have coexisting medical illnesses, it's important to make sure that your health is optimized at this point. And one message that as a public health physician I am never going to miss an opportunity to get out is if you are currently doing something that is compromising your respiratory tract, like smoking or vaping, stop. There is good reason to suspect that individuals who smoke may be at higher risk. This is not conclusive. It is an association that we've seen based on data out of China, which interestingly suggested a significantly higher rate of complication in men than women. Why does that make sense? We don't know the answer to that, but what we do know is that there's a significantly higher rate of smoking in men than women. So this may be something that factors in and is always an opportunity to be addressed.
I do have a follow-up, if I may. Sure. You stated that there are certain at-risk populations, those which I'll schematize by saying the elderly. Are there other cohorts that we should be paying particular attention to, or how do we educate ourselves about that?
So, you know, it's important to note that as we see with influenza season every year, even though we may know what populations are at risk, we still have young, healthy people that get influenza and die every year. It is not unlikely that this will occur with this virus. So it's important for everybody to practice these infection control practices and not think that they're immune. In terms of individuals that may be concerned that they're in a high-risk cohort, it's a good idea to, you know, have a conversation with your doctor about whether your current medical regimen is optimizing your health and to continue to utilize these measures to prevent yourself from being exposed.
Hello, my name is Dylan Klein, freshman here. So you talked about the cases in Westchester. I'm from New Rochelle. This person lived down my block, along with the 4 other people that are now confirmed to have it in my city. So I'm scared to go back in 2 weeks, just felt like I should mention that. The governor today recalled all the SUNY CUNY study abroad students, which I'm happy about. What I'm not happy about is the continued talk about how this is just a thing that's probably going to blow over eventually. They've been touting the mortality rate, which from the WHO is now 3.4% worldwide as of this morning. The US mortality rate is 9%. This is the similar death rate of the 1918 Spanish flu outbreak, which killed 50 million people. So I'm concerned about that because they're touting this as something that's going to blow over, something that we just need to be a little bit aware about. If we have it, we're quarantined, so on and so forth. But it's not that bad of a situation. When these numbers are matching up with something that killed 50 million people, that is nerve-wracking. the upcharging of Purell on Amazon. For a 4-pack, it's $327 now. So I want to know, for the University at Albany, when these students come back, when they are in quarantine, are they going to have their quarantine paid for? Because the CDC has no idea if the government is paying for quarantines that are now government mandated. We have no clue of procedures of what's going to happen on this campus, because the only 2 emails we got were a month apart, one on January 31st and one on March 2nd. There has been no guidelines given to us on what will happen if there is a suspected case on this campus. Because if there's a suspected case on this campus, this is a campus with 17,000 people. If there is a case, do you plan on canceling classes for the day, the week, or even the entire rest of the semester? Because I will tell you right now, if there is a confirmed case on this campus, there will be a large majority of students who will refuse to go to class out of fear. Because these study abroad students should have been recalled the first time there was a case in these countries, and we should have been taking precaution when we learned that there was a first case in the US, especially when we learned that someone died in Seattle, like a week ago? We should have been prepared. So I want to know, will you guys be prepared to make that tough call to cancel classes for however long it will be, if, and I hate to say this, when there will be a case on this campus, because the way it is spreading like a pandemic. So please, thank you very much.
No, and I think there were kind of 3 questions there. Maybe I'll try and address one, and then maybe Liza another, and then Kevin a third. I think the first is the issue of fatality rate, and I think you're quite right to take the number of deaths divided by the number of cases that we've seen so far. I think one of the things we see in public health is we're still learning about what that fatality rate's going to look like over time. We see the numerator faster than we see the denominator, and as the testing has been slow initially out of CDC, there may well be more cases than we know of at this point. And so I think that estimate, it's something I'm very interested in as well too. And I think sort of tracking, as you said, the 9% as of this morning in the US versus about 3.4% globally, where will that settle in over time as testing rolls out and we know more about the denominator? So I think it's an important issue and one that we're going to learn more about. And Dr. Whalen, about the issue of living in New Rochelle and the time frame from exposure.
Sure. So first of all, I would like to thank, that was a student, correct? I would like to thank you for your passion. And I want to assure you that we have been very closely working with the university for the past month. So most of the questions that you ask, we have addressed. First of all, I'm not sure who they is that says this is not a big deal. It's unprecedented. And, you know, we really know that this is a situation that's rapidly expanding. You use the word pandemic. The World Health Organization has not made that designation yet, but it is certainly looking like that. So I would agree with you on those points. And I would say, in terms of where you're from, people should know that local health departments currently, as part of the containment strategy, are doing very close epidemiologic monitoring on every single case. So that means identifying every single individual that a case is in contact with, contacting them and trying to ensure those containment measures of staying home for 14 days, being monitored by the local health department until they get beyond the stage of contagion or developing the disease. So that you can be assured of. In terms of making a call, we will work very closely with the universities and with other public entities and schools, whether it's K through 12 or universities. Local public health will make that call. We are ready to make that call. We stand ready to make that call. That is part of our planning that we have had, as I said, for the past 10 years for pandemic. So these are things that are being addressed daily and have been addressed for years. We have plans in place that we are currently implementing. And I do think that you make an additional point about, what can you do? How can you feel empowered yourself? And I would advise looking at that CDC website to kind of get an idea of what's helpful for you personally to help prevent infection.
To jump right off of something Dr. Whalen said, if we had a case on the campus, it's not going to be the campus by itself making these decisions. At that point, the county health department, state health department will be involved, And as Dr. Wellen said, they're going to track back to every person that this person had contact with, and if that means that you shut down things because of where the contact was made, that will happen. And that's not going to be even an option the university has. We're going to be told what we need to do there. And as far as the students that are going into quarantine, there are two options. They can go, and paying for that, they can go home, and we suspect, let's face it, a lot of parents are going to want to take their son or daughter home. We're advising them on how they do that to make sure that the person stays in the room, has a bathroom that they're using by themselves, that bathroom is wiped down regularly with the correct products, that food is brought into them. Whenever it's brought into them, the patient has a mask on so that, you know, if there's any contact, no touching and that kind of thing. There is another option that the governor is putting in place, which is centralized quarantine for the students coming back from abroad. They're trying to set up facilities at various SUNY campuses. To my knowledge, right now, we're not one, and for that to have the proper setup, and that's part of the reason we probably won't be one. We really don't have that necessarily available because we're in session, but they're looking for that, and they will cover all of that that's necessary for those who maybe don't have the resources to do that for themselves.
And I would also say that the county health department has been charged with quarantine. We have quarantine responsibilities. So we have had to identify a place to put people that need quarantine. Not only do we are we charged with putting them someplace, we're charged with giving them what they need to stay within that 2 weeks. Whether it's food, whether it's health services, whether it is mental health related considerations, whether it's a pack of cards, whether it's cable, whether it's Wi-Fi. We are charged with doing that now, and there is a lot of talk about how that funding is going to enable us under our preparedness budget to be able to pay for that, but that's our job.
And I know we're over time, but let's take these last two questions, please.
As was mentioned earlier, one thing that we can all do in this stage is social distancing. And my wife's work has done an extraordinary amount of stuff in the field of social distancing. They have cancelled meetings, they've banned vendors from coming on site, they're asking employees to limit the sharing of equipment and things like that. And we've had 2 emails given out to us. I'm faculty, I work in the physics department, and none of them have mentioned social distancing. It's obviously a very unique challenge to a campus like SUNY Albany. And I'm just wondering, is the school developing, and will they share any policies or guidelines for social distancing as it applies to the day-to-day interaction between us and our students and educating our students? Like, do we ban office hours? Do we ask people to sit with an empty seat between them? What do we do when the lecture center is full of students and they have to sit next to each other? How are we going to do that?
Well, I think, and again, we're trying to find guidance of where we are, follow guidance from the county health department and CDC of where we are in this. Let's face it, we're in this environment here today. To hear this, it's very difficult on a university campus to have everybody 6 feet away from each other at all times. And that's why we're monitoring. And now if the county health department says to us, here's where we are now, or in CDC, you have to have everybody 6 feet away from each other, we will take those measures that are necessary for that. And people should use their own, caution. I mean, even in your own, if someone has an office, if they can, move the desk, the chair that you're meeting with the student further away, if possible. I mean, I don't think anybody's going to take offense if you, like right now, if you said, I'm not going to shake your hand because of what's going on. No one should take offense. I don't think anybody will. We're trying to follow the advice that we have the best that we can. And, if it becomes something where you can't be, we need to go into isolation, that's when it's potential for the university to be ordered to shut down because of that and mass gatherings. That is something we also are talking about and watching. The incident management team will be talking about that, from everything from sporting events to other gatherings. We're seeing conferences. I've had a faculty member reach out. They were going to be hosting a conference here. It's actually well into the year. Should they cancel that? And the answer is not at this point. It's in October. But we're looking at those. We're trying to monitor, but we've got to follow the advice we're being given on that, of when that might be necessary.
And I would just say that there is a lot of guidance on that. At this point, it's been stated, it can't be understated, we're still in widespread influenza time of year. It is much more likely that you will contract influenza than you will contract coronavirus at this point. The measures for control are the same. We start every year in the fall to talk about measures to control influenza, but I think people are starting to now say, well, what can I do to prevent myself? So those practices such as hand hygiene and respiratory etiquette and staying at home when you're sick are essential right now. In terms of creating social distancing and staying 6 feet away from people, we don't have evidence of community transmission right now. That could change. And when that changes, that's when we really start to consider making those decisions.
Last question, please. Thank you.
Hi, my question is regarding more of the social stigmas around the coronavirus. So even on the UAlbany campus, there have been a lot of social stigmas around particular groups of students that may have the coronavirus based on their skin color, racial status, and ethnicity. And I know you mentioned earlier that it has nothing to do with that, it's the disease. So what is your guys' plans in terms of kind of separating the two and, informing people that just because you are a person of color, just because you come from a different background, does not necessarily mean that you have the coronavirus or COVID-19?
Well, and that goes back to what we're talking about. One of the committees that we have set up is to approach that very thing. How do we support our students on this campus? Not even have been affected, but have been affected by this in that manner. That is something that's just, this university doesn't stand for, okay? And we talk about whether it's an ethnic group or race or whatever, let's face it, most of the students that are coming back to this campus from study abroad are not international students, okay? And they've been at risk, and we're caring for them that way. This is not about a country, it's not about a people, it's about a disease. And any one of us, and there's not a single person in this room that is any less or more likely to get it, other than if there's a underlying health issue, as the doctor said. And that is a message that we're trying to get out there. That's not what this university stands for. And in that group, that we're trying to find opportunities to do that in that statement. And I know the president came out at one point and did make a statement about that. We can do that again, because we share completely exactly what you're saying, that no one should feel targeted, and they don't have to look over their shoulder, and they don't have to worry about anything in their normal daily life because of this. And it's extremely unfortunate that anyone would go there, and we're doing what we can to try to knock that stigmatism down.
Thank you.
Yeah, I would echo that and just say, you're a university. You are academic people, so you look at things from fact-based and science-based, not nonsense. And that is how we fight this, is with factual information. So any kind of stigmatization is not supported. And I'm glad to hear that the university is passionate about that as well.
Thank you very much. I know that we're a little bit over time, but I just wanted to thank all of you for attending today. It's been a really rich discussion. It hopefully will not be the last of such discussions, of course, that we have, and there'll be more forms of communication through email and so on as well. But thank you for today, and thank you, everyone. We're adjourned.